My name is Eileen Burbage. I'm the Executive Director here at Fertifa, and what I'm looking forward to chatting with you about today is in our series of Please Mind the Reproductive Health Gap, what's missing from private medical insurance and why it matters for your workplace, for your colleagues, for the employees that you support from a well-being perspective, but also from a productivity and a business perspective for the business. Quick note before I get into some of the specific content. I know it might be really tiny, you might not be able to read it, but just a note on language, as I might be inadvertently careless about language. When I speak about men or women, because I'll speak often about men and women's reproductive health today, I am actually using that to refer to an individual's sex as they were assigned at birth. Everything that we do here at Fertifa is to try and perpetuate the belief and the real conviction that we have that healthcare needs to be very inclusive. So we hope not to be exclusive or to sound as if we're not talking to anyone who might have a question, or even just thinking about benefits for others who have questions relating to reproductive, hormonal, and sexual health. With that having been said, a couple of other housekeeping points. I have mentioned already my name and my role. I'm the Executive Director at Fertifa. Really, really pleased to be representing, therefore, the company, and I'll talk about that briefly at the end. But I also wanted to flag that the session is being recorded, so you hopefully already got that notification. This is so that others who might not have been available to join us live or in real time today could potentially watch back the recording later, or even you could refer back to it, as I hopefully will share some interesting data points and some really relevant statistics that might help you when considering what you might want to do for your own workplace. So because it's being recorded, we do have a Q&A function that does allow you to post anonymous questions. I will be keeping an eye on that the whole time. So if you see my eyes going across the screen or not focused on the camera at any given point, know that I'm not actually trying to multitask with anything else, but trying to keep an eye on the Q&A and also the chat function. So we also have chat enabled where you are able to ping me directly. So for example, if I end up running into some kind of a technical difficulty and you stop seeing my slides or you stop hearing or seeing me, please let me know or feel free to ping me in the chat. I'll keep an eye on that as well. Again, in the Q&A function and also in the, well, actually less in the chat, I'm sorry. In the Q&A function, you can be anonymous. You can make your initials visible and your name visible to me when asking a question, but you can also do that anonymously. If you choose to chat with me in the chat function, that is not anonymous, so I will see what you mentioned, or I'll see who's mentioning that, but I will appreciate any feedback, like I said, particularly if there's any technical difficulties, which has happened so many times. I don't really care to think back on it. I'll go back into sort of trauma again. So those are the points on housekeeping. Moving right along then in terms of what I'm hoping to cover today. I mentioned that the topic is about gaps in private medical insurance. Obviously, I'll talk about how great it is as well. I'm not here to bash private medical insurance by any means. And as some of you might already have expected or assumed, every single Fertifa client that we have the privilege of working with already has private medical insurance in place for at least some of their colleagues, some of their employees. And so we really do see ourselves as very supplementary and complementary to private medical. It's not an either or, certainly not mutually exclusive, but we're here to talk about why we don't necessarily believe that private medical insurance is typically comprehensive enough and why it does leave gaps, and therefore hopefully working with an organization such as Fertifa might be of interest to you. I'll then talk about the impact, of course, on employees and of course on the workplace, employers, the business case, the case therefore then for more comprehensive coverage, potentially then supplemented with a specialist provider, whether that's us or one of our peer organizations within the sector. And I will leave time for Q&A at the end. But in order to break up the monotony of my voice, which I know I'll appreciate and hopefully makes it more interesting to you as well, please again, feel free to post questions in the Q&A or in the chat function as we go. It's really much more interesting to me to know what's on your mind, maybe something I've said has resonated with you, or actually you totally disagree with. That would be really, really interesting for me to know. And I'll potentially and very happily steer the conversation. You know, I've got this outline here in this table of contents, but I'm really happy to take the conversation in a different direction, particularly if that's relevant to you, because then it's more likely that it's also relevant to other people that are on the webinar as well. So please do let me know what you think, or if you've got any questions as we go. And just case in point on that, even though this is the sort of outline that we had assumed might be useful for people, I'm going to launch a poll right now, because depending on the answers to some of these poll questions, maybe I don't cover some of these topics, or maybe we talk about things entirely differently. So as you'll see from the poll, apologies if some of it's wordy, that is my fault. I sort of asked the marketing team to make things slightly more specific than in terms of what we'll be talking about. The first question is whether or not you, not necessarily as an employee having coverage, but as an employer. So thinking about the company, does the company presently offer or have PMI in place for employees? That's the first question. Second question is, does that PMI policy then and that coverage include coverage for reproductive health matters, whether it be fertility and family forming, for example, whether it be menopause, whether it be sexual and hormonal health, whether it be menstrual health, maybe contraception. So just thinking about reproductive health topics, is that covered under your PMI plan? And also, is that covered even when it's not specifically as a consequence of maybe a cancer diagnosis or other clinical diagnosis, for example? So again, pretty wordy, but still not wordy enough. That's the question for if you answered yes, of course, whether or not that's covered. And I think we've got the combination, or the three questions are whether or not you've got PMI. Secondly, if the PMI covers reproductive health. Thirdly, if that PMI coverage actually is also for what some plans, I know not all, but some plans might be referred to as elective reproductive health or lifestyle choices, as opposed to necessarily healthcare. So those are the three questions. Thank you so much for those of you who participated. We've already had more than half of you respond in. I'll just give it a couple of more minutes in case more people want to. Thank you. And I see it going up, lodge their opinions or their views in terms of where they're working right now. And then I'll share the results in a couple of seconds. And it's really interesting what we're seeing. So I really appreciate you asking. It also helps to inform and give us feedback on how we phrase these questions in future. So again, thanks for taking the time. We've got now 80% participation. So I will go ahead and end the poll and then share these results with you so you can see what I'm looking at. So not surprisingly, more than 3/4, almost 80% of you say that your workplace does already have PMI offered. And actually what's interesting is that 7%, so it's actually more than, sorry, it's about 7%. I was going to say close to 10%, but I won't say that because it's close to 5%, if anything. But some of you with the private medical insurance in place only have that available for certain cohorts of the workplace. So maybe senior managers, maybe executives only, maybe certain types of salary bands, for example. But we'll see that it does include, you do have PMI, some of you only for certain people. I don't think I'll have to say them, therefore, we would suggest that might not be wholly inclusive for the entire workplace, but that's not a problem. We'll come back to that in terms of inclusion and how to ensure that people are feeling that coverage or support is accessible to them. And then on the second question, whether or not reproductive health issues are covered, the vast majority are saying 65% that it's not. Although I will flag that close to 20%, so 19% aren't sure. So that's fair enough. And so for those 20% or those 90% aren't sure, it could be. I would posit that it's most likely not, because that is our experience. And again, that's why all of our clients have chosen to work with us, because whilst they already have private medical in place, they don't feel that it's got coverage for reproductive health topics. And then for those for which it does, because many will do, but only as a consequence or as a diagnosis or referral from a physician or a GP relating to, say, a cancer diagnosis or some other medical condition, for example. So we're seeing that even those that do, actually 5% are saying that it will cover it, even if it is a lifestyle or what some other plans might cover as elective. So that's really helpful. Thank you so much for answering that. I guess it does confirm our sort of view that this is for companies that have probably already put private medical in place in order to support their workplace and in order to make sure that their employees feel that they have options for healthcare and for looking after themselves. But it also does validate the point that there's certainly at least enough uncertainty, if not certainty, that it doesn't go the full sort of way in terms of covering reproductive health topics at all, or in some cases, if it's not as the result of another medical diagnosis, whether that be cancer or otherwise. So I do think, you're probably going to think that's convenient of me to say that I'll probably stick largely to this agenda. But again, depending on what you responded, what you contributed to that poll, please do lodge points in the Q&A or in the chat function and let me know if there's anything more specific or even more general, maybe across industry sectors, for example, or across regions or different countries that you'd like me to address. Otherwise, I'll go ahead and I'll get going then in what we'd already prepared. First thing maybe I should have said before launching the poll, because it is another point on semantics, like I'd said about language in the covering slide. When I talk about reproductive health, I just want to be crystal clear that I'm not just talking about healthcare as it relates to individuals who might want to reproduce or those who have already reproduced and might already be parents. When we at Fertifa talk about reproductive health, we are talking about health and looking after our healthcare and our well-being with everything related to our reproductive health system. So that's our reproductive organs, of which every individual has, our reproductive organs, our hormones, the reproductive health system more broadly. So this is not just for parents, not just for people thinking about becoming parents. It is for everyone, even if they've decided, for example, they don't necessarily want to be parents in the future or for now, or if they're well beyond that or well before that. At no matter what age or point of a reproductive cycle somebody's at, they do have reproductive health to think about. And we are talking about topics that might relate to, for women, for example, just normal, in speech marks, menstrual health, for example. A woman's, monthly period and her cycle can contribute to up to 9 days of unplanned absences or sick leave a year. That directly contributes, of course, to their productivity, that of their team, that of anyone who relies on their work, and of course, the organization at large. So we're talking about reproductive health more broadly. Having said that then, and maybe just looking at how this correlates to the poll results, actually you were showing that more of you already offer access to private medical insurance than those across, I guess, UK on a more blended basis or more average basis, generalized. So in the UK, more generally, only 13% of individuals have access to PMI. So again, you represent workplaces that have already thought about this for your employees, which is brilliant. And for those of you that already have that in place, there are some that actually don't, but you should know that, close to 70%, then 68% of individuals do say reproductive health benefits would influence their job decisions, whether or not they take a job, consider a job offer, or prefer to prioritize it over another. So moving on from that in terms of some other stats, when we look at private medical insurance, so even if it is in place, and this largely kind of tracks with what we saw in the poll results, globally, 67% of PMI policies will exclude fertility treatments. And this is looking at policies which cover more than 500 lives. But 67% of them, those policies won't cover fertility, for example. So will not cover IVF or assisted reproductive technology, will not cover preservation such as egg freezing, sperm freezing, or embryo freezing. And in this case, this statistic, again, for more than 500 lives, so it might be different if it's a PMI scheme or a policy that's for a larger organization, a corporate, or even one that's targeting SMEs. But for more than 500 lives, and to a certain degree, we're talking about exclusion of fertility treatments, even with a diagnosis, a medical diagnosis relating to cancer or otherwise. And so this does mean that for a large percentage of the population that thinks about fertility, and hopefully you know already all the stats, which we haven't included on these slides, but 1 in 6 heterosexual couples now do face challenges when looking to conceive. 40% of that time, that is going to be the male factor issue. We now have more individuals looking at becoming parents in their 40s than we do in their 20s. That's a huge generational shift. And therefore, that contributes to the fact that more and more people are having to at least consider or explore whether or not fertility treatment is something for them or given their circumstances. And then the statistic, and I should have said this already, is even higher for all of us in EMEA, and EMEA including the UK in this case, not really taking Brexit into consideration, but thinking about geographical output. So employers in EMEA, and of course, Asia Pacific as well, we're at a higher exclusion rate, which is 75%. So fertility and family forming not included in private medical, even if the organization already has private medical insurance in place. Even so, when we think about private medical, and so whether or not it would have inclusions or some sort of coverage for fertility treatment, whether it's for a cancer diagnosis or otherwise, typically, as you must all surely know, because you have private medical in your workplace for some degree or another, it is intended and designed, that is private medical insurance, to cover acute medical conditions. So an acute situation or circumstance, as you'll know from conversations or from wording such as pre-existing medical conditions, lifestyle conditions, or something as a consequence of age or otherwise, medical insurance, private medical insurance is not necessarily in place for preventative care, for ongoing health conditions, and for so much of healthcare, which probably afflicts individuals and certainly contributes to their well-being and productivity at work. So it's designed for acute conditions. It's designed for diagnostics and testing potentially, and genuinely just thinking about inpatient or outpatient care, so clinical care. Therefore, we think it falls short on reproductive healthcare topics because it is simply reacting to an acute medical condition, potentially acute symptoms, the onset of symptoms or symptoms presenting themselves, again, not related to hormonal health or age. And it does lack preemptive, preventative, and proactive reproductive health services. So somebody thinking about contraception, somebody thinking about conceiving in future and whether or not they might need assisted reproductive technology or whether or not they've already determined that is the case for them. Somebody going through perimenopausal symptoms, for example, maybe a gentleman that is considering a vasectomy or a reverse vasectomy, or just thinking about his sexual health. These things are typically not covered under private medical insurance. And again, here another stat in terms of how important this is. We know that almost 3/4 of employees would believe that their employer should offer some form of support for reproductive health challenges. Now, granted, the statistic is such a big number, almost 3/4, because the level of support could vary. Maybe in some cases, employees responded to this survey in this way because they were thinking they wanted education and awareness. Maybe they simply wanted signposting to specialist providers. Maybe they wanted an EAP. Maybe they wanted PMI, but maybe they also wanted champions within the workplace, employee research, sort of resource groups or employee networks, for example. But in a lot of cases, we'd suggest many of them wanted well-being support in one form or another, as well as access to specialist clinical care and clinical advice. So then trying to sort of bring all of this together, what are the gaps that we are talking about? So I've alluded to statistics, I've alluded to what PMI is initially designed for, what it would typically cover, what percentage might exclude some reproductive health topics, but here we'll talk a little bit about some specifics. So when we think about reproductive health for women, often what we see excluded, and I've talked about this already, is fertility or assisted reproductive technology, and IVI, I've mentioned IVF, IUI, but ICSI, other forms of assisted reproductive technology, as well as egg freezing and preservation, embryo freezing, are oftentimes excluded. Additionally, menopause, which is really a form of hormonal health, happens to every single woman. And again, minding my language, every single woman who's identified as female at birth, everyone who was producing estrogen and progesterone for releasing eggs in a monthly cycle will go through menopause when they stop releasing those eggs. 1 in 10 women then going through those perimenopausal menopause symptoms will leave their jobs. They will leave work. Maybe some of them are going to be unregrettable leavers, but clearly not every single one. And this is a vast, vast number. So today it's estimated that there are 13 million women in the UK who are going through perimenopause or menopause and have some degree of symptoms. If you think about 1 in 10 of them leaving the workplace, that's a massive number and will obviously be a massive hit to the UK's GDP and productivity overall, let alone each of our individual workplaces. Other topics would include endometriosis and PCOS. We know that the average time to diagnose endometriosis in the UK is now 7 to 8 years. We know that this can affect 1 in 10 women as well. It's debilitating, crippling pain. It can include really, really heavy bleeding. And it's really problematic given how long it's being taken to diagnose. These topics are typically not covered. And if it's taking 7 to 8 years to get the diagnosis in the first place, even if it was covered under private medical insurance or PMI, it would be hard to get the treatment, the attention, maybe the diagnosis in the first place until it was diagnosed. So you have a bit of a chicken and egg there. And finally, thinking about just contraception and menstrual health. So there's limited coverage from PMI for contraception. We see very, very few PMI policies that'll cover this. For instance, we know that there's more than 100 different forms of oral contraception available, and we know that there are only 3 that are covered under the NHS. Clearly and very reasonably, those will probably be the most popular. They'll be therefore also the most cost-effective for the NHS to provide, but it's got to be the case that for at least some women, talking through a different form of contraception is going to really significantly positively impact her well-being. But that wouldn't be necessarily covered under PMI. And then looking at men's reproductive health coverage then, I've already mentioned that stat that 1 in 6 heterosexual couples will have troubles conceiving and therefore face infertility challenges. 40% of those cases will be male factor related. And so whilst we still see in general, women will start to get themselves tested before men, 40% of the time, nearly half the time, it's the male factor. And yet sperm freezing, preservation, and conversations about this are typically not covered under PMI. Separate topics about erectile dysfunction or vasectomies, which I already mentioned as well, often excluded despite increasing demand. And erectile dysfunction will affect more than 70% of men at some point in their lives. They'll have questions about it. They'll have questions if it's recurring, if it's a one-off, if it tends to increase or decreases over time, what might affect it. And having conversations about that is typically not covered under PMI, but we would think should be under a reproductive health well-being package. And then STI screenings and treatment. Clearly, you could go to, or anyone could attend a sexual health clinic at the NHS. And some of these topics will also be just as comprehensively covered under the NHS. And so I should just make a comment about that. But even if it is, you're seeing that close to 30%, so close to 33% or 1 in 3 men will avoid testing for STI because they're worried about the cost, or they can't be bothered to go to the sexual health clinic, or they don't have time or don't want to be seen in a sexual health clinic. So we are seeing that, again, additional support would make a big, big difference. And just a quick comment then before I go on to the family sort of portion of the slide. So with the NHS, and of course, we've spoken to prospects who say, listen, it's really unlikely that we are going to pick up an additional or supplemental benefit when many of these topics are under the NHS. And we think that while it's fantastic that we have the NHS here in the UK, I think it's clearly a national treasure. I do think no one can dispute the fact that we're probably at peak NHS availability now, if we look going forward. So what I mean by that is, I think it's unlikely. I'd love to see it differently. I have children at home who will come to rely on the NHS as well, so I'd like this not to be the case. But I think it's incredibly unlikely that there will be greater availability of the NHS, greater provision, greater number of resources, shorter waiting times, easier access with the NHS over time, just given the direction of travel with funding, with the demand on resources, with doctor training, with physician bandwidth, and with all of the different topics now that are facing the NHS. And so even if it is covered, we know with reproductive health topics, there can be a postcode lottery just because it depends on the NHS trust that somebody is a member of or their GP with whom they're registered in terms of how long they might have to wait for an appointment, let alone any kind of diagnosis or any kind of support with any of these topics that we're talking about. And I suspect those challenges are the reason why all of you responded that, or so many of you responded that you have access to private medical insurance or your company's already providing that. And the point here is that even if you're offering PMI, there's still that gap. And so finally, because I've talked about fertility and family forming already, that does cover to a certain extent this yellow box, then the last one on this slide, which is for families, which is, only 6% of employers are offering some level of surrogacy and adoption support. When I spoke about above fertility and sexual health, I'm talking about assisted reproductive technology, and you've heard me now rattle off these acronyms for IVF, IUI, ICSI, egg freezing, sperm freezing. There are clearly different paths to parenthood, and many LGBT individuals in your workplace will be considering or thinking about surrogacy and adoption as well. Non-LGBT employees will be thinking about surrogacy and adoption as well. I'm just making the point that nearly all LGBT employees will need some form of support in order to become parents. And so this disproportionately affects those colleagues more than anyone else. But if without adoption and surrogacy support, that means that individuals really have no place to turn to in terms of questions, where to go, what resources are available, what types of agencies they should engage with, whether or not commercial surrogacy is even permitted in the country in which they're employed, and so on and so forth. So this is just, I guess, a top level, high level view of some of the gaps we would see within reproductive health coverage, or how it manifests itself and on what topics when you compare and contrast to PMI and of course the NHS as well. But again, if you've got comments, you've got questions, you disagree, or you think I've missed something completely, please feel free to let me know. So therefore now the impact on employees and employers. And again, since you've kindly given up your time to join me for this webinar today, I'm probably already preaching to the converted, but I think some of these stats are useful, or they're slightly different than maybe the other stats that we've already talked about. For employees, we know that up to half of them will delay fertility treatment because of the cost and because of the sort of the uncertainty of what they're going to have to undergo. They don't know whether or not they can, in speech marks, take time out of a work project or what's happening at work in order to attend fertility treatment. That's even if they get over or can overcome the challenges with respect to cost. We know that it increases stress, obviously absenteeism, even if somebody undergoes or starts to pursue treatment, whether that's for testing, whether that's for consultations and the like. But there's probably absenteeism even when they're undergoing the anxiety and the uncertainty of what to explore. And clearly that all leads to reduced productivity, which will impact the team, projects, deliverables, and the company at large, in addition to the days of absenteeism and the lost productivity there. So therefore, for the employers, not only are you seeing that impact on productivity, which I was just alluding to, which will translate to bottom line, which will translate to time, effectiveness, and efficiency of the organization, but you'd also need to know that 20% of employees have stated that they would switch jobs for better fertility benefits, for example. So you might also have regrettable leavers if there isn't coverage or support for fertility and family forming, not to mention perimenopause and menopause and all of the other topics that we've already mentioned. This, therefore, obviously leads to higher turnover. There is lower impact for greater diversity and inclusion initiatives that we would suspect everybody wants to support. Even if there's a backlash against some of these terms, I think we all know that we've seen better results, whether it's on the investment side, deliverables, productivity, product design, clients, customer engagement, when you've got diverse teams and when you've got your talent that you want around the table. If you've got people who are looking to leave jobs because they're in pursuit of something else to support what's happening with their reproductive health, then that is going to translate into bottom line impact for you. So the case for comprehensive coverage, it's the other side of the coin of everything I've been talking about when I've been talking about the gaps and the impact. Clearly, it's trying to address all of that. But again, a few more statistics in case they're helpful to you. You're seeing more and more of this, or we are certainly with all of our prospective clients and certainly the clients with whom we've already contracted. 62% of Gen Z and millennials do consider reproductive benefits or reproductive healthcare benefits a key factor in job selection. They do look at it. I would argue in some of the cases, I mean, this is not going to be an empirical stat, but many of them, because of their age and where they are in their lives, it's more important and it's more topical to them than pensions. Anyone starting their career is not yet thinking about saving or contributing to their pensions as much as they're at least thinking about, because of what's happening in society, potentially with friends, or maybe family pressure about when they might think about becoming parents, whether or not they're in a relationship yet that will sustain that, or whether or not they think they'll do that with the partner that they're with or on their own. So it's very, very relevant for Gen Z and millennials. And then here's just a nice stat, which is nearly 90%, 88% of companies offering fertility benefits do see improved employee retention. There's also a similar number, it's actually higher, more than 90% of employers who then go further and actually offer policies to reimburse or to cover some of the treatment costs for their employees do see that they make that money back or they save money over time, not just because of the productivity, the reduced absenteeism, all of which contributes, but even just based on the fact that they will see fewer claims on their private medical insurance because they're looking at covering the preventative and the preemptive care of reproductive health. They actually see fewer medical claims relating to these topics. So with all of that said, then why, and obviously we would make this case, but these are the reasons why we think it's worth considering at least partnering with a specialist provider. And again, appreciate that a number of you already responded to the poll that this was already on your agenda for 2025. So these might be pretty obvious. I'm not going to read every single one, but clearly there's this expertise in the field. So for example, at Fertifa, but this is the case with other providers as well, we have an in-house clinical team. We're led by a medical director. He's one of the leading lights within fertility, reproductive health, hormonal health. And he then therefore trains the entire team, which is comprised of midwives, nurses, other accredited professionals who will be clinical advisors to talk one-to-one with employees of our workplace clients. They'll be there to talk about any of the topics that I've already mentioned, and they're here for ongoing support, well-being support as independent medical advice. So because the business model of a specialist provider is not on trying to charge the employees or who we see as patients, because the contracting is with the employer, and therefore we're aligned with the employer to maximize engagement. It's not an incentive, doesn't affect the economics. We're not actually trying to dampen engagement by any means. We are looking to make sure the employees have access to an independent medical opinion in order to help inform their decisions. And I say this as somebody who's gone through IVF myself and attended a private clinic. You might think you have access to specialists without a specialist provider, or without a well-being provider on the side. But I can tell you that when you go to a private clinic and they give you some advice or they tell you something, you can't help but think, if they're telling you this because it's in your best interest, medically, clinically speaking, for you as an individual, or because they're looking at another customer for an IVF cycle that might pay upwards of £9,000, £10,000 for a cycle. And so the well-being support that we provide is independent, and it's on behalf of and as an advocate for the employee as a patient, not to try and steer someone towards a private clinic or even the NHS. So it's independent medical advice, and it's specialist advice based on clinical and accredited training for these topics, which is beneficial over, say, an EAP, for example, or PMI. It's also then flexible and scalable. So we work with, for example, at Fertifa, SMEs from as few as 10 employees all the way up to tens of thousands, and some of the world's largest companies or brands that you'd recognize. Because we're a specialist provider, because we think about these topics, we can therefore scale up accordingly, or also be bespoke to smaller workplaces as well. We can then also talk about different topics. It's not the case that everyone necessarily wants to or needs to take all of our what we call pathways of fertility and family forming, plus women's reproductive hormonal and sexual health, plus men's reproductive and sexual health. Maybe there's already a specialist provider in place for one or more of those, but you're looking to fill a gap. Again, that's where Fertifa can come into play. And also we help with the financial access as well. About half of our clients do pay towards some of the treatment costs, and I mentioned that in terms of the ROI that they would see. But for those clients, we do the administration. We help that, but we manage that for the employees' privacy and confidentiality, so they don't have to feel that they have to talk in detail or share receipts and invoices with someone at the company, and we're protecting their confidentiality that way. But on the other hand, we're doing compliance for the company. So for example, we have processed more than £5 million worth of reimbursements for our clients, across all of our clients in the last couple of years. But more crucially, from the workplace's point of view, we've pulled out more than £400,000 worth of ineligible claims. So claims that were duplicate invoices, maybe in a different name, maybe outside of the policy that the workplace had put in place. So for example, outside of country of employment, or maybe more than a year's worth of egg freezing, or maybe they hadn't been tenured long enough in the company, again, based on the company's policies. So we are here as a compliance check. And then we also offer a payment plan as well for workplaces that don't have budget or don't want to forecast what a reimbursement might look like. We also have a Fertifa payment plan where we can potentially pay for the treatment on behalf of the employee, and then work with the employer for us to get paid back at no risk to the company and at no interest and no fee to the patient or to the employee to pay us back over the next 12 months. So we are flexible and scalable, and we cover also financial access as well. And then, of course, we can help be cost efficient in that way, because you'll be able to see from us what the outcomes are, but what the management information would look like, what the utilization looks like, what the engagement looks like, which webinars are resonating with your workplace, what the cohorts look like in terms of people going through consultations and potentially assessments or diagnostics. Obviously, that's all anonymized. We're not sharing any confidential employee or patient information, but it helps you to understand then what makes a difference for your workplace. And that's the impact that we can bring from the well-being that you want to provide to your employees. And then finally, we can see, and we are happy to tell you that we have a greater than 90% employee satisfaction rate. We see that CSAT. We're doing a QBR earlier today with a client. Their CSAT was 95.6%. We do feedback on every single one of the calls. I will tell you that the reason why we can't be closer to the sort of maybe 5 nines is because a lot of times the satisfaction might be related to whether or not there's reimbursement and cost coverage. So we might unfairly get swept up on that, but in terms of the well-being support, we get overwhelmingly positive feedback, which naturally will reflect on the organization and on the benefits team or the company for including the benefit in the first place. Sorry, I've advanced too quickly there, gotten ahead of myself. Here is just a recap then, following on that last slide, which talked about why work with a specialist provider. This is just meant to show non-exhaustive list, all the different topics that can be covered by a specialist provider such as ourselves. Clearly, there are others in the market as well that might specialize or be more narrowly focused. But in terms of working with Fertifa, these are the topics that we gladly, happily, with pride and responsibly talk to all of our current clients, employees about today. And then you'd already seen this, but this is the recap about why we were talking about this. We are Europe's most comprehensive reproductive health benefits provider. Much of what I talked about in the financial access is what really makes us the most comprehensive, because there will be others that might cover the clinical topics in a similar way, but nobody else in the UK does reimbursement administration today, and nobody across Europe offers a payment plan, as I've described it either, that is potentially available for your employees. So hopefully that's been a helpful run through of PMI, but also the gaps, also why we think it's impactful for employees, but also for companies and maybe for yourselves as representing the companies that you're with and the employee benefits teams or the HR teams and the well-being teams. I'd really, really like to answer any questions that's on people's minds. We had a couple that came through, which I didn't sort of call out or read out specifically, but that's because I think I answered them as I went. So whilst you think about whether or not there's any other questions or things that you might want to flag, I can also, very happy to share with you another poll, which is with respect to feedback. So maybe this will prompt additional questions as well, which is that curious to know whether or not the webinar has made you more interested in potentially introducing reproductive health benefits, potentially alongside your PMI, whether or not that might be on the agenda then, therefore, for 2025. In terms of other points of view, I wanted to also share that we have, and I'm going to stop sharing my slides if that's all right, so I can sort of see if there's more flags, because I do see more questions, but it's easier for me to stop sharing my screen, and then I'll be able to answer your questions even more readily. So somebody did ask, by the way, a question, thank you for that, whilst you're answering the poll, which is from a logistical point of view, how Fertifa works alongside PMI. So that's a great question, and I'm sorry, I probably should have explicitly addressed that, because in candor, we don't actually integrate as such with a PMI provider. We don't have to, implement anything. We don't have to do hooks into them. We don't necessarily need to be communicating directly with a PMI provider. But because we are so accustomed to working with PMI providers for all of our existing clients, I am pleased to tell you that we're so accustomed to it that as part of our onboarding, when we work with a client, before we launch the benefit, part of the onboarding, of course, is to make sure that our team is trained up on and is aware of your PMI policies. So we make sure that we have from you all the information about the policy. We'll make sure that we will understand what it covers, what it doesn't. And so in the case of somebody coming to us, we will signpost the employee to PMI if that's more appropriate than coming to us. However, even in the case of, say, financial reimbursement, because this is something that I think is really important, we will see that, for example, as I mentioned, some PMI will cover instances of fertility support, or maybe even egg freezing. Maybe there has been a cancer diagnosis or another medical diagnosis or reason for somebody to be covered under a PMI claim. If we know that, we will 100% signpost them to PMI before having the employee submit a claim to us for reimbursement through what might be a separate pot, and as we've described, the sort of supplemental access to some kind of financial access or the like. So we are here, and I keep saying as an extension of the well-being team at your company, but I should be careful about that because obviously we'll protect patients' privacy. We don't pass information back. But in the sort of alignment of wanting to look after people and also look after your business, because ultimately that's the business case that we're making for you, which is that we are impacting your productivity or the company's productivity, and we're actually making the company a more efficient and a more effective commercial organization because we're affecting, you know, the ability to retain, to recruit, but also in order to maximize productivity. We're also mindful about not, you know, simply squandering money for the sake of it, or potentially having reimbursements go through when something would qualify for PMI. So thank you for that question. Hopefully I've answered that as we went. The last thing I'm just mentioning in the chat is that if anyone had more questions that I don't have time to cover, because I do usually like to end these at a quarter till and give everyone at least 10 to 15 minutes before the next call. So I am now speaking more quickly to try to wrap this up in the next couple of minutes. There's other questions that you have that I haven't covered off. As an HR individual or somebody who's considering a benefit, not if you have an individual question about your circumstances, but if you have questions about working with us as a specialist provider, please feel free to click on that link or get in touch to speak to the member of the team. You can also lodge a question if you work for a company that's already engaged with us, of course. I think those individuals should know how to get in touch with us, but that would be through booking in through the app. And that's the way to know whether or not you've got Fertifa at your workplace already. You will already hopefully have an account for Fertifa or know how to register for an account. But if people have questions about that, get in touch with us for that as well. Thank you so much for those of you who participated in the poll. I'm happy to share the results of the poll. I think people are being very kind. It's probably those that didn't respond to the poll that would have said no to the first question. So those of you who have responded are very kind to me and probably not wanting to make me feel bad. But those of you who responded said 100% of you would be now more interested in potentially working with a specialist provider in addition to the PMI cover that you already have. More than half of you, so 64% of you also said you would consider maybe looking into that for this year. So again, for those of you, please do feel free to book in a call, as I've mentioned in the chat. I do have another question that's come in, so I'm happy to take that. And for those of you who want to drop off because you've had most of your general questions answered, I just want to say thank you so much again for lending your time and for joining me today. Really appreciate the feedback as we've gone along. Would look forward to your feedback afterwards. If there's anything in future you'd prefer I have covered or mentioned, or even just the way I modulate my voice or not, we're always looking for any kinds of feedback. So thanks so much for your time. The last question then, for those of you who are staying on, somebody has asked whether or not, or what's the best way to find out whether or not this is something that employees would want or use, and what kind of uptake or utilization do we usually see? So it's a great question, and I appreciate somebody asking that. So even if you as an individual are thinking about it for your workplace, you've got to make the case clearly from a business point of view in terms of being able to forecast or predict what utilization is. I think many of you know, depending on the benefit that's in place, I would say benchmark utilization across optional or elective benefits can range from 20 up to 50%. Higher probably for PMI, we typically see. For these types of benefits, which would fall under well-being or specialist well-being, I think best in class is going to be 10 to 20%. And we typically see, even without any kind of internal comms, we'll see at least 5% engagement. And for those companies that actually do include communications along with other elective benefits, even though Fertifa is not elective and it should be offered to the entire workplace, and that's the way we price it, we'll see 10% without comms up to 20% or more. I will also be very transparent and say utilization increases if there is that financial support as well. But we do see that increasing quarter after quarter now across all of our clients, more generally speaking, because of how much more frequently these topics are coming up. And because of how normalized the conversation is getting, particularly around topics such as perimenopause, menopause, for example, and others. And also with men's health, we're seeing a lot of that with Movember, particularly around awareness days, for example. So we would encourage you to make sure that you're thinking about everyone in the organization. And hopefully I haven't made this sound too women-centric or women-focused. We are talking about reproductive health for everyone. So I think that's the last question that I can see. And again, sorry, my eyes are going all over the screen. Appreciate the feedback that's coming in the chat that only I can see as well. That's really kind of everybody. But thank you again for giving up your time. Let us know, get in touch if there's anything else. If you've raised a hand and have a question, I think it's probably easier for you to put it in the Q&A or in the chat. That would be easier for me than getting mics on or unmuting people, or get in touch thereafter. Really, really happy to speak to anyone personally or individually if you want to get in touch with me directly, but the team is really happy to have a call if you click on that link as well. So thank you again, everybody. Real pleasure to speak with you today, and I look forward to hopefully chatting with all of you again in future. Take care. All the best.